Almost every second adult has high cholesterol. Cholesterol is in the top 3 risk factors for heart disease. And heart disease itself is the number 1 cause of death in the world. Most people with high cholesterol do not know they have the problem because it has no symptoms until it seriously damages blood vessels. Cholesterol is a waxy-like substance produced in our liver. We need cholesterol for our cells as it participates in forming cell membranes. Also, some hormones are created from cholesterol, such as sex hormones, androgens and estrogens. We have 3 main types of cholesterol: good, bad, and very bad cholesterol. They're called HDL, LDL, and VLDL. The difference between them is that bad cholesterol enters cells and brings cholesterol into them. Good cholesterol removes excess cholesterol from the cells, and very bad cholesterol carries triglycerides from the liver to the body. When it drops triglycerides, it is converted into bad cholesterol. The problem with bad cholesterol is that if it is in excess, cholesterol deposition starts on the artery walls and creates cholesterol plaque, which causes narrowing of the arteries, blood flow problems, and sometimes clot formation and complete blockage of arteries, which we see as a heart attack or stroke. The test we perform to define cholesterol levels is called a lipid profile or lipid panel test, when we measure total cholesterol and its fractions. If cholesterol is high, it means that our diet requires modification in most cases. When cholesterol is high, what is to blame? The first is genetics. Genetic predisposition means a lot. Even, for example, 2 persons in the same environment can differ, with one having high cholesterol and the other normal. It is definitely genetics, but we can modify this genetic predisposition with our lifestyle. The second most responsible factor for high cholesterol is our diet, which we address in detail. The third is obesity and a sedentary lifestyle. The fourth is lack of exercise. And the fifth most important factor is smoking. It is optimal to maintain cholesterol levels below 200 milligrams per deciliter. And it is better if LDL cholesterol is below 100. Even normal ranges are commonly cited up to 160. And triglycerides below 150 is optimal. The 10th most important food which you should avoid is trans fats. Trans fats affects liver and reduces synthesis of apolipoprotein A, which is important for good cholesterol. So intaking trans fats decreases good cholesterol level. They weaken LDL receptor sensitivity, leaving the liver unable to remove bad cholesterol from the blood effectively. They increase bad cholesterol levels and decrease good cholesterol. Baked and processed foods contain trans fats, and many margarines, especially older formulations, and contain trans fats. Also, trans fats are created when oil is used for frying and reused several times. You should avoid trans fats as much as possible. When buying food, it should be labeled as trans fat free or showing 0 grams trans fat or 0 partially hydrogenated oils, which also means trans fats. The 9th most important food to avoid is processed meats such as bacon, sausages, and hot dogs. They increase LDL cholesterol levels because of their high amount of saturated fats, which prompts the liver to produce more LDL. The 8th most important food to minimize is full-fat dairy products because they also increase LDL cholesterol levels.
When it comes to dairy products and their effect on cholesterol, studies are mixed. For example, some cheese or yogurt have a neutral or sometimes beneficial effect on cholesterol. This can be due to a combination of many beneficial components in dairy products. Aside from saturated fats, but when the saturated fat intake is replaced by unsaturated fats, for example from nuts or olive oil, studies consistently show cholesterol improvement. So it means dairy products still affect cholesterol to some degree. Generally, an intake of 1 cup of milk, around 240 milliliters, is considered safe daily, while cream's higher fat content might pose more risk if consumed in large amounts. As a general principle, your total daily fat intake should be less than 6% of calories. In other words, if you eat 2,000 calories daily, you should intake less than 13 grams of saturated fat. And 1 cup of whole milk contains 5 grams of saturated fat. But remember that we also get saturated fats from other sources during the day. Generally, standard milk has a 3.25% fat concentration, while cream has around 30 to 40% fat.
The seventh important food to mention is cheese. Cheese is high in saturated fats, but it also contains many beneficial components such as calcium, protein, casein, fermented byproducts, specific fatty acids, and in some cases probiotics. So, in the case of cheese, study results are mixed and not conclusive, but intake of cheese in moderation and portion control is crucial. A safe daily intake of cheese is around 1 to 1.5 ounces, which is approximately 30 to 40 grams. There are some studies where consuming 80 grams of cheese did not increase cholesterol levels, especially compared to butter. This can be explained by its high calcium content, as calcium in cheese may bind to these fats, forming insular salts that are excreted in feces, reducing absorption and potentially lowering LDL. The sixth important food is fried chicken and French fries, as they can raise LDL cholesterol. Primarily through their saturated and trans fat content, frequent consumption of fried foods is strongly linked to negative health outcomes, including effects on cholesterol levels and overall cardiovascular risk. Studies consistently show correlations between higher intake of fried foods, especially those prepared away from home, and increased risk of developing high LDL. Saturated fats reduce LDL receptors in the liver, and as a result, the liver is unable to clear bad cholesterol from the body effectively.
The fifth food is egg. Historically, eggs, specifically the yolks, were heavily cautioned against due to their high dietary cholesterol content. However, extensive research over the past couple of decades has shown that for most healthy people, dietary cholesterol has a less significant impact on blood cholesterol levels, particularly LDL cholesterol, compared to the impact of saturated fats and trans fats. The body often compensates for cholesterol intake by adjusting its own production. Intake of 2 or more eggs increases cholesterol levels. Roughly, adding 1 more egg to the diet increases cholesterol levels by around 4 to 5 milligrams per deciliter. This response is not universal. For some people, eggs affect cholesterol levels more. And for some less, the fourth important food to avoid is baked goods and pastries, such as cakes, donuts, and cookies. They raise NDL and lower HDLB because they are often made with butter, shortening or hydrogenated fats that are high in saturated fats and trans fats. The third food is fast food meals because they are commonly loaded with saturated fats and trans fats due to processing and cooking methods, and they significantly increase bad cholesterol levels.
The second in our list is margarines and oils. Most modern margarines in regions with strict regulations are reformulated to be low in or free of trans fats. However, it is still important to check labels, because imported or specialty margarines might contain trace amounts. Sunflower oil contains unsaturated fats, which are not associated with increased cholesterol and is considered relatively safe. Also, olive oil, rich in monounsaturated fats, is well known for its cholesterol lowering benefits and positive impact on heart health, although butter is high in saturated fats, which have been shown to increase bad LDL cholesterol levels. Coconut oil and palm oil are high in saturated fat, and this saturated fat content increases a bad cholesterol by prompting the liver to produce more LDL cholesterol. The frying process oxidizes any oil, and the oil becomes more harmful. However, if we consider which is a safer alternative, sunflower oil is still safer compared to butter and animal fat. And the number one food to better minimize for cholesterol is fatty red meats, for example, beef and pork with visible fat. They increase LDL cholesterol as they are high in saturated fats, which prompt the liver to produce more LDL. The relationship between saturated fat intake and increased LDL cholesterol is very well established through decades of research, including highly controlled feeding studies, and is considered a strong causal link.